Hello, today we are going to talk about the day fig technique. The member is Alison Cando, Anay Salgado, Josué Silva, I myself, Darla Chuquilla. Bitewing technique. The proximal radiograph or between snow, which is the proximal surface of the chin and the crest of the alveolar bone, but a hypergence and mandible in the cell field is also known as biting one. Use follies of the interproximal radiographic technique. Crown. Contact areas, incipient proximal caries, stem and deep of caries. Abrasion, adduction, coronary fractures, filling step extension and adaptation, as we can see in the Yemens. Pulp cavity, site, stem, relationship with fillings, calcification and resorptions, as we see on the X-ray. Cervical regions. Dental calcuts, widening of the periodontal ligament space or abscess of the closing curve. Resorption of the alveolar crest, regain varies, and crown adaptations. Next, I will talk about some of the benefits of this technique. Number 1. These X-rays show your teeth about the gum line and the height of the bone between your teeth. Number 2. Help diagnose periodontal disease and cavities between the teeth. And number 3. Its performance correspond to the true crown area. Number 4. It is used in adult patients with the openings and molars and premolars. And finally, number 5, in a children with opposing premolar molar, with primary and premolar molars, and in a patient with opposing molar and premolars. Thank you.
Now I am talking about Bitewing film size. Size 0 is used to examine the posterior teeth of the primary dentation, and the long position of the film is placed horizontally. Size 1 is used to examine the posterior teeth of the mixed dentination. The filament is placed horizontally, and in permanent dentation in the anterior sector is placed vertically. Size 2 is used to examine the posterior tip of the permanent dentination, and the film can be placed horizontal or vertically. The last is size 3, that it serves to examine all the areas of the contact between premolars or molars, and however it is not recommended since it does not adequately observe areas of the crest bone. Now I am going to talk about Bitewing cone angulations. First is horizontal angulation. It is placement of the central ray with respect to the horizontal plane from to side. As a result, the contact areas on the radiographic look open and sinks caries can be observed. And we have vertical angulation. That is the position of the cone with respect to the vertical plane or from top to bottom. It can be positive in the cone is placed above the occlusal plane with ray pointing downwards, or negative when the cone is placed below the occlusal plane and the lighting in direction upwards. Now we have Bitewing exposure for premolars. First, put the radiographic rotation at the patient, and now place the patient with his back straight and position his head so that the jaw is perpendicular of the floor. Looks in front of the patient and sets the vertical angulation to plus 10 degrees. Now sets the horizontal angulation, and now examine the posterior curve of the face. Align to the opening of the jaw so that it's parallel to your index finger and the curvature of each premolar area. After this, make sure that the code covers that upper and lower canines in such a way that there are equal parts in an upper and lower. Now place the film without moving the central part of the cone. Now fold the film in half and fold it. After this, insert the film into the patient's mouth and place of the lower half between the film and the teeth. And finally, place the biting surface on the film in the occlusal plane of the teeth.
Exposure of molars with Bitewing. First, we can set the vertical angulation of 10 degrees, face the patient, and set the horizontal angulations. Second, we can examine the posterior curvature of the arch to the better appearance. It place your index finger along the molar areas. And third, we can align the end open and cone so that it parallel to your eyes, fingers, and the arch curve in the molar areas. The fourth pass is direct the central ray to weigh the contact areas and make sure the cone is sufficiently forward to the cover. The upper and lower cone premolars and spack equal portions of the upper and lower arch to the avoid cone cuts. The fifth pass is the middle part should be directed and the level of the place occlusal. And the sixth pass is after the stability of the patient, we can vertical and horizontal angulations, together with the positions of the cone and the place the film without the moving and the feet tape and out of the fate. The seventh pass is we can insert the film into the mouth of the patient and place the lower half between the tongue and the teeth. The eighth pass is insert the film into the mouth of the patient and the place. And we can have the center of the film in the second molar and the anterior edge of the film should be aligned with the middle of the second premolar level. After that, index finger on the tip of the agonist, the surface buccal molar, and we hold the like this during steps 5 and 6. Make sure the patient occlusal plane in the parallel to the floor. After that, if necessary, seek the patient to lower his clean to the check that it can cut. Stand directly between the pupil hat and the log along the cone. That not portion of the screen should be observed moving. This is very important because this must be covered on the opening of the cone. And the finally pass, if I don't know watch the movie, instructor the patient the close slowly while still holding on the top. And if any portion of the film there will become out, in this case adjust to the cover movie, then ask the patient to close slowly while the hold and took spare film. After that, we are going to talk about modification to the technique. We have many modifications to the technique. One of these is the modifications can be to be technique of Bitewing. There are to accommodate various anatomical conditions of the patients. With operations, we can make these modifications are necessary in patients to have spacious dentures of many growths. After modifications, I am going to talk about edentulous or edental space. What is edental space? Edental space is an edental space in area where teeth are mixing. This is a problem of placement between, and it is necessary to modify the technique. One of these places cotton is waved in the areas of the missing teeth to hold the film or older. After other pass is when the patient close teeth agonists include the cotton is waved and support the top of the frame support. And when this is not archment in the image, it often inclinate occlusal plane and final the radiographic. There we can see a radiographic of a dental patient that is a panoramic radiographic. It's for that we can see a space of the teeth.
Hello, my name is Jose Silva. I will then explain the advantage and disadvantage of a Bitewing X-ray. To begin with, we must account that this radiographic has the advantage of less exposures or radiation. We has another cost in another to have a three-dimensional image of the structure to the observed. The objective of this technique is to outline images of the crowns or area cervical vertebral of the maxillary and mandibulary tear. We can observe, for example, a alveolar bone, interproximal caries, interproximal surface, anis condyles on the claw, and periodontal tissue. Okay, as this graph a three-dimensional structure on a flat surface and three are only two planes of space, the entry pathological process is not slow. However, its disadvantage is that this technique does not serve to identify alteration in soft tissue, just as identifies polymerization and can understand or oversight the depth of the lesions and detects only 5% of cursor lesions. The most frequent errors that this technique presents is the incorrect clean presence is a common error in the technique proximal. In the area of the premolar and molars, it is a common not to cover the mesial face or the premolar, the area of the molars. It is common not to take the field fat enough back, coating the distal face or the three molars. Okay, if the upper edge of the field contacts the gingival margin of the palate, the film may slide down on the floor on the mud as the pattern closes. It results in the radiographic that appear more like a periapical film. This is more likely to happen with wearing a Bitewing. If the deep DEP is not placed correctly, the X-ray may not cover the entry mode. This is known as area on the field where the silver sats were not exposed to X-ray.